Hello everyone, this is Dr. Sam and this video is about appendix and appendicitis on a CT scan. We will compare the normal appearances of the appendix with its abnormal appearances in a CT scan. The main pathology associated with appendix is appendicitis, which is the inflammation of the appendix. On the left side, we have an axial image of the abdomen, showing the appendix in the right lower quadrant. This small tube-shaped structure is the appendix. In normal cases, it will appear thin. The diameter will be less than 6 millimeters approximately. This low density area, the dark area around the appendix, is fat. Normally, fat appears homogeneous and hypodense, that is dark. It appears dark because fat is of low density. And over here is an image showing acute appendicitis. The image is magnified so you can see the pathology clearly. You can see an increase in the size of the appendix. It is dilated and filled with fluid. The diameter will be more than 6 millimeters. These low density gray areas inside the appendix are fluid. Another feature that is commonly seen along with a swollen appendix is the increase in density of the fat surrounding the appendix. The fat becomes brighter and more heterogeneous due to inflammation. This feature makes it easier to diagnose appendicitis when it is seen with a swollen appendix. Clinical symptoms such as pain in the lower right abdomen, pain intensifying with movement, and fever can help support the diagnosis. It can be difficult to locate a normal appendix on a CT image because it does not have a fixed location. Bowel gas and feces can obscure the appendix. The appendix can hide behind the cecum and can blend in with the cecum, which makes it hard to see the appendix. Sometimes the appendix is too small to be seen in some patients. In this image, we can see the appendix over here near the cecum. If you see this normal dark gray fat in this region near the cecum and you are not able to locate the appendix, it is safe to say that the appendix will be normal too. Here is another case of acute appendicitis. This is the inflamed appendix. The hyperdense, bright structure is the appendicolith. Appendicolith always appears bright because it is a calcified fecal material. If an appendicolith is present, it becomes easier to locate the appendix. In some cases of appendicitis, a Caecal Bar Sign can be seen. It is this inflamed tissue seen between the cecum that is filled with contrast and the inflamed appendix. It is only seen when contrast medium is present in the cecum. Another sign that can be seen in a contrast-filled cecum is the Arrowhead Sign. This arrowhead shape of the contrast in the appendiceal orifice can be seen in some cases of appendicitis. The coronal plane is very helpful in viewing the inflamed appendix. Here in the normal image, we do not see the appendix. This is very common due to various reasons such as the variable location of the appendix, presence of bowel gases and fecal matter, which can hide the normal appendix. An inflamed appendix, however, is much easier to find. We can see an enlarged, swollen appendix over here. IV contrast is administered, which enhances the walls of the appendix. Periappendiceal inflammation is present. The fat around the appendix, which was supposed to be low density or dark and homogeneous, is appearing brighter and heterogeneous, indicating inflammation. This is another image of the same case. The enlarged appendix is seen more clearly here with periappendiceal inflammation present. Here is another coronal image showing the normal appendix. This appendix is filled with gas. The black area within the appendix is gas. Since the appendix is not enlarged, the gas is a normal finding. And over here is another image of appendicitis. We can see the periappendiceal inflammation, the bright, high-density areas in the fat surrounding the appendix. The appendix is enlarged and is filled with gas. This intraluminal gas seen in an inflamed appendix can indicate a gangrenous appendicitis. This type of inflamed appendix is more concerning because it is prone to rupture and lead to a more serious condition known as perforated appendix. This is a magnified image in axial plane showing the normal appendix. The fat surrounding the appendix is normal. This is an inflamed appendix. It is enlarged. There is a significant amount of periappendiceal inflammation. Here is another image of the appendix. This thin tube-shaped structure is the appendix with normal fat. And in this image, an appendicolith is seen within an inflamed appendix. Here is another case of acute appendicitis showing an enlarged appendix with an appendicolith over here. Periappendiceal inflammation can be clearly seen surrounding the appendix. A gangrenous appendicitis often involves intraluminal gas within the inflamed appendix. This is due to gas-producing bacteria involved in the infection. This gas strongly indicates a gangrenous appendicitis. Some parts of the wall of the appendix may not enhance after contrast is administered due to necrosis. Significant fat stranding or periappendiceal inflammation is present, and appendicolith is also noted. This type is more prone to rupture, leading to a perforated appendix. This is gangrenous appendicitis in axial plane. A hyperdense appendicolith is seen within the appendix along with intraluminal gas and periappendiceal inflammation. This is an image showing perforated appendix. A focal wall defect is seen over here. Gas is also present outside the wall of the appendix. These features strongly indicate perforation. These high-density areas are of periappendiceal inflammation. In some cases of perforated appendix, wall defects and extraluminal gas may not be found. Instead, we may find a large inflamed mass at the site of the inflamed appendix. This high-density, bright area with irregular borders is called phlegmon. This can occur with severe inflammation of the appendix and is often associated with perforation. The phlegmon and abscess are often found together. The abscess has a lower density than a phlegmon. It appears slightly darker. The abscess will have clear borders. These borders will enhance when contrast material is administered. You can see the bright wall of the abscess with darker, slightly lower density abscess inside the wall. And this bright, irregular structure is phlegmon. Here we can see the phlegmon in coronal view. It usually has a higher density than an abscess. There is severe inflammation, and this strongly suggests perforation. The abscess has lower density than the phlegmon, so it appears darker. The abscess has a border which enhances with contrast material. Here is another case of perforated appendicitis. A large inflamed appendix can be seen with an appendicolith over here. Focal wall defect and significant fat stranding are also noted. Thank you so much for watching. Please subscribe and stay tuned for more imaging videos.